This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Health Center on Jackson Street in Oshkosh, and we're talking about supplements. You know, you walk into the store, there's a whole big wall full of all kinds of options, but today we're going to try to clear up some of the confusion as we sit down with nurse practitioner Evelyn Andersen. Well, thanks for taking some time with us. We're talking about food, we're talking about supplements, all the things that can potentially make us a little more healthy. What are some of the general rules we should follow when we're just talking about our diet to make us a little more healthy?
Okay, so when you're talking about supplements to begin with, what you want to make sure you're doing, and what I emphasize with patients, is first you want to try to have a good diet for which to base supplementation on. If you're not eating enough macronutrients and eat like fats, proteins, and carbohydrates that are good quality, what are we really supplementing first? So again, the first thing that I want to make sure we're doing is eating a lot of vegetables, a lot of fruits, limiting processed foods, limiting sugar, things that we know can be detrimental to health.
Okay, so sticking a supplement on top of eating all those other bad things doesn't necessarily help.
It's not going to cancel it out, no.
So there are supplements that are beneficial to us though, aren't there?
Yeah, there's definitely benefit to taking supplements for certain populations. I would say that if somebody is eating a fairly good diet and they want to know where to start, one of the first recommendations I make is a high quality multivitamin, one that has all the B vitamins, vitamin A, zinc, selenium, kind of covering all your bases to make sure that any of those macronutrients or micronutrients that you're missing in your diet are supplemented.
I walk into the store, there are walls and walls of supplements, or a pharmacy, wherever you go, there's a lot of different things on the market. How can I tell which one of these supplements are going to be best for me?
Good question. So it can be overwhelming looking at, I've certainly, before getting a little bit more educated myself on this, you look at this wall and it's a little bit like, where do you begin? There's all sorts of options for just one, vitamin C, which one is the best one? Well, a general rule is if you've got a multivitamin that you like, the thing that I try to direct patients to look for is a label with the letters USP, and that means that they are testing that at a facility outside of their own where they're making this. That's a paid service, so they send it out. It's actually quality tested to make sure the claim on the label is actually what's in the capsule or each vitamin itself. Another option is to call, which is a little bit more time consuming. But there are companies that don't pay for that service but still continue to test. So you can call those companies and ask, can I please have a certificate of analysis to show what indeed you're claiming is on your label is actually in what I'm taking? And if they give you kind of the runaround saying, well, we can't get that this month because X, Y, and Z, that's probably a good indication they're not testing for quality. And then you're kind of just wasting money, and that's what I truly try to eliminate. Healthcare is expensive as it is, and you don't want to be just wasting money on something that doesn't have what it claims to have.
Right. Here's a question for you. I don't know if you can answer this, but how do I know if a supplement or my diet that I've changed, whatever adjustments I've made, how do I know that that's working?
Well, it's difficult to really determine if something is helpful because we get a lot of these things from diet anyway. And that's why there's certain providers that will say, well, it's not really beneficial, and that's fair, because these nutrients exist in your body anyway. If you were to test, each person is going to have a little bit different level. So the basis, I go by symptoms. If somebody is taking, say, magnesium for a therapeutic reason such as sleep or anxiety, we'll go by how they're feeling. I'm not really going to test that in someone.
Okay. When somebody's taking prescription medication, can supplements interact with that? Can some of them be a problem with medication?
Well, a good question as well. As far as the interactions go, that's why I want to make sure that if you are taking supplements, it is important to tell your healthcare provider you are taking them. I've had patients show up with cardboard boxes full of empty supplement boxes, and I'm like, these might not all be necessary. So there are some interactions that can happen between certain medications, as well as depletion of nutrients. One of the most common, especially for females, obviously, is oral contraceptives. It can deplete vitamin C, vitamin D, vitamin A, and B vitamins, which can cause some other issues down the line if that's a compounded problem. It doesn't happen in you take one pill one time and you have these symptoms. It's kind of just a progression. So I make sure, again, to to recommend all my patients on oral contraceptives, do take a quality multivitamin to kind of support that. Statins are another one that deplete, and that's the way they work, is they work on this enzyme called coenzyme Q10. And that's where people will have muscle fatigue or pain, discomfort in their legs, cramping. When they take statins, it's because you're kind of wringing that dry and you're depleting that coenzyme Q10. So supplementing with that can kind of eliminate that side effect as well. Antacids, PPIs can deplete magnesium and zinc and calcium. So those are also things that if you can look to get off of them, it's a good idea. But if you're not, then supplementation might be beneficial.
I know you can't just wave a wand, prescribe one supplement or one vitamin for everyone to take, but is there something that we all need to boost, whether it's a supplement, a nutrient, a vitamin? Is there something we should be taking right now?
There is a lot of conflicting evidence coming out about fish oil and vitamin D, but those are two that they tend to be high yield as far as preventive qualities that they have, and also the way they act on the body. Vitamin D is used in probably every process in your body. So if we're not getting enough of that, which we do not in Wisconsin, that isn't kind of the number one thing. A high quality multivitamin is a good place to start. Probiotics are also really good, but that's a whole nother conversation. And magnesium as well.
All right. Well, great information and something we certainly all need to do, increase our diet and maybe look into some supplements. Now, if anyone has questions about supplements or nutrients that they need to take, what's the best way to get the information?
Talk to your doctor.
Give you a call? Get a hold of your primary care provider.
It's kind of definitely one of my interests, so I tend to research it a bit more. But
all right, very good. Well, we appreciate you taking some time with us today.
Okay, thank you.
Now, if you have any questions about supplements, nutrients, vitamins, all the things we just talked about with Evelyn, you can always give her a call or talk to your primary care provider at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Health Care.